Hi everyone, this is me, Ify again. Today's lecture, we're going to be talking about enoxaparin and also known as Lovenox and Eliquis. So, enoxaparin, Lovenox and the Eliquis, and Lovenox and Eliquis, they are both um, anticoagulant. Sorry about that. I kind of lost my speech. So I just wanted to quickly put both of them together. While Eloquence is oral, um, Lovenox is given subcutaneous, uh, in a subcutaneous injection. And then we use the Eloquence for patient that has maybe AFib, arterial fibrillation. What is arterial fibrillation? Like when the heart quivers, it's not beating like it's supposed to be, um, lapped up like it's supposed to be. So when the heart is quivering, so we use that medication. Doctor usually prescribe it for that patient, and they are used for long-term anticoagulant therapy. So this patient is put in there. For the Lovenox, when patient come in and either have a procedure or something they did that the patient is not able to move around, and we want to prevent patient from having a blood clot, PE, and all that. So we put patient on Lovenox, just like we put on heparin subcutaneous. So heparin subcutaneous and Lovenox. The doctor usually give the patient either one of this, either one of this Lovenox or heparin. So the criteria depends on the patient history, the criteria of why the doctor will choose this or not and not choose the other. All this depend on the patient history and the patient allergy and all that picture. That's why he's going to be picking that. So on this medication, we are also going to, just like every other anticoagulant medication, we're going to teach the patient to monitor bleeding. And like I said earlier, anybody remember what I said earlier about bleeding? When the heart rate is very elevated and the blood pressure is low, the patient could be bleeding. When there is a lot of bruises, hematoma, black stool, there might be bleeding. So we should check on that. Another thing we are looking at is patient platelet. So if the platelet level of this patient is less than 1,000, 100,000, 100,000, this medication should be held. This Lebanon must be held, except the doctor says otherwise. But, notify him and see what he says. But the instruction is, if it's platelet is greater than 1,000, this must be held. So we have to notify the doctor for any deficiency. Monitor the patient for sensational movement of lower extremities. Check him for hematoma. These are the things you have to do for this patient. So this is just a very short video. So it's just to let you know, because it doesn't have a lot, just like every other anticoagulant that I have discussed. There is nothing different from this. You just have to monitor the blood bleeding for this patient, because what happens with anticoagulants, the blood thinner, it thinns. They're all blood thinner. It thins the blood, that the clotting factor becomes less. So we as nurses, what we do when patient is on this kind of medication is to monitor the patient from bleeding and make sure they do not bleed out. So that is just a little bit of teaching. So that concludes my anticoagulant lecture. So we'll be moving on later to the next one. Maybe the next one I'm going to double is the antihypertensive medication, and maybe either review your study guide that you gave me the last time. So review that. So hope to see you soon, and keep studying. It pays off. Give me thumbs up and subscribe so you can always see when I upload the video. All right. Thank you. Bye.